Hi, Andrew from Waikato Podiatry Clinic here. We've been seeing a lot of ingrown toenails and infections lately, and so I thought what I'd do is shoot a short video for you to give you a bit of a heads up on how you can manage some of these at home if you get them early enough, or if they're just starting to become a problem and not a full-blown ingrown toenail. So what I'll do is I'll show you the difference of what a bit of inflammation down the side of the toe is, or paronychia as it's called, and a full-blown ingrown toenail, and then what you can do to try help manage that for yourselves. See, in this situation here, we've got the redness down and through the base of the nail here. This is usually more of an indication that there's an infection in the sulci. More often than not, it's been caused by compression from side to side, or there's been a bit of a bug or a bit of dirt that's gotten into the side of the toe here. Usually what we will find with these, if they become red like this, is that there is a little pocket of infection or pus down and through the base here. And what we want to do is we want to allow that to escape, and also at the same time we want to allow our antiseptic cream to be able to get into that site and help clear it up. With an ingrown toenail, classically, not always, but classically it's usually more up towards the front end of the nail here. And will be to do with broken skin or infection or poor cutting, or just a wedge of nail that's growing in up here. So this is probably more of a paronychia. So what we would do with this sort of situation is we would use a small bowl of warm water like this, and what we would do is we would use just some table salt, and we would put around about a tablespoon. We use warm water so that the salt is able to dilute, and we use salt because it's a natural antiseptic, and we use water because what we're wanting to do is we're wanting to loosen that area up, and we're wanting any exudate or any pus that's in there to be able to allow to escape. So what you would do is you would soak down and through there, probably for about 10 minutes or so. Let it get nice and soft. You would take it out, give it a dry. And what you can do is you can just pull away from the side, down and through here like that, so that if there is any exudate down and through the side here, then it can come out and escape, and that will make it feel a little bit more comfortable. Things to note is that if you have any underlying conditions, any peripheral vascular problems or anything like that, then you need to be very careful with managing these and come in and see us straight away. Diabetes is another condition that you wouldn't muck around with these things. Sometimes what you can do is you can use a toothbrush and you can just gently scrape along and up the side like that, and that just helps to clear out any bugs or any dirt that's down the side there. What we would do then lastly is that we would dry it off with the sheet, and we would apply liberally some betadine down the side here. And what we would do if we're going to, and usually we would put a dressing on here, is that what we would do is we wouldn't put it tight over the top of the toe, because that will push the sides of the toe onto the nail, and that will tend to make it sore. So we would just lightly place it over here like that. And what that does is it helps to keep the betadine in place and stop it getting on your sock, but also just keep it nice and clean as well. And what you would expect is within 1 or 2 days, that should start to be looking and feeling a lot better. If it's not, come in and see us at Waikato Podiatry Clinic.